Hello and welcome to the latest episode of EFT Changes Lives. My name is Mary-Jane Sharratt. I am a trainer of emotional freedom technique and also a practitioner. And today I am absolutely delighted to welcome Maria McMahon, which I hope I've pronounced correctly, Maria. Maria is a medical doctor and an EFT practitioner and an acupuncturist based in Northern Ireland, just outside Belfast. Maria, hello. It's so great to see you today.
Hello, Mary-Jane. Thank you for having me.
So, Maria, can you tell us first of all what made someone with your background as a medical doctor and an acupuncturist have an interest in EFT in the first place?
Absolutely. Well, I was always really interested in integrative medicine. So basically wanting to, I always felt that the medical model didn't fully suit me. So I was always interested in things that could be added in to that to work alongside it. And I was at an integrative medicine conference in London in 2018, and there was an EFT session.
Ah,
And I went along, and the practitioner did a demo at the front with somebody from the audience, and we all tapped along with it. And I just found it fascinating. I realized that during that session, I was actually starting to feel better. I was
mm.
calmer. I just felt something had changed. I felt a little very emotional at one point, and I couldn't believe this was happening in a room full of about 100 people. So I thought, okay, this is something I want to sort of look into a wee bit further.
Yeah.
Um, so I luckily came across your lovely website and realized that I wanted to do training in it. And I thankfully then did that in around before COVID, so about 2000, and I actually don't know if it was before COVID, I can't
I'm not
remember.
sure. I can't remember. A few years
Um,
ago. Shall we say
during
a few
during
years
the
ago?
COVID years.
Yeah,
Yeah,
absolutely.
so I did that a few years ago, and I am so happy from a professional and a personal point of view that I have EFT in my life.
Yeah, yeah. And of course, it really aligns nicely with acupuncture because we are tapping on the acupuncture meridians or near the ends generally of the meridians. So, it's got a basis, a good foundation in acupuncture too.
Absolutely, absolutely. And we know so much more about it from the science point of view and how it works. And for me, it's brilliant. I can combine it for people if I want to. I'm doing started some group sessions where I use auricular acupuncture and EFT together, and they work so well together.
Yeah.
It's a brilliant tool to have in your, yeah, the toolkit or whatever.
Yeah. Absolutely. And also, of course, you're probably not encouraging people to stick needles in themselves between sessions, but they can tap.
They can tap, absolutely. Yeah, and they do get so much. I have a few people who do it, and they love it, and it really helps them with sleep or with anxiety or stress. Yeah, in between sessions, I just love that it's something you can use straight away, and for me, that's so important day by day. And that's what I do day by day. I probably do a wee bit more crisis management. I need to learn to do more of the um, do it myself just as the personal peace process.
Yes.
Um, but for me, it works as soon as I start to feel a wee bit anxious or stressed or poor sleep, things like that.
Yeah.
I can use it straight away. So for me, it's a brilliant tool to have.
Yeah, fantastic. And Maria, a couple of years ago, 2023, you had quite a challenging year. Would you like to tell us a little bit about that and about how EFT helped you through that?
Yeah, absolutely. So in January 2023, I went for a routine mammogram. I've been having them since my early 30s because my mum had breast cancer. And I was unfortunately called back to get a biopsy done, which I thought initially it'll be fine. I've had this done before, I've had a cyst. But as the fifth biopsy was being done, I realized that this was probably slightly different. So yes, I was diagnosed with breast cancer in February, then 10 days later after the biopsies.
Yeah. And
Um,
there's probably a bit of something about knowing too much as well with your medical background. You kind of knew 5 biopsies, that doesn't look good.
Yeah, it didn't it gradually dawned on me that things weren't possibly going the way that I'd hoped that they were going. And then the and again, from a medical background, I have so much more appreciation now of the waiting that people have to do for diagnosis, the waiting between tests. It is quite excruciating. And that is one of the reasons why I was so happy to have EFT because I was able to manage my anxiety to some degree. Because it's a long, long time, and your head goes to all these places that it doesn't really want to go to. And with mum having, unfortunately, she had a recurrence in her 60s and died at that point. So for me, the what ifs and the going to
Yeah,
the worst case scenario happened a few times. But thankfully was able to work with yourself and work myself sort of in between sessions
yeah,
to be able to reduce that anxiety.
yeah. Do you mind telling us a little bit about the treatment process that you had? Obviously, that varies depending, on the individual, on the type of cancer, etc. But what happened to you? What did you have?
So absolutely. So for me, I was diagnosed with estrogen positive breast cancer, thankfully localized to the breast itself, and no lymph node involvement. So it meant that I hopefully the plan was initially that I would have my surgery, lumpectomy, with sort of a sort of a yeah sort of area taken away from around the lump. And then the hope was that I had have radiotherapy only. But unfortunately, whenever I got my oncotype carried out, which basically they can check to see the likelihood of how chemotherapy may help reduce your risk of recurrence in the future.
Hmm.
Mine was sort of borderline for my age, so I had a bit of a choice to make um, as to whether I would have chemotherapy, but I decided that that was probably the best option. I would have regretted if I'd had breast cancer again in the future. If I hadn't gone ahead with the chemo, I would have kicked myself. So, I went for the chemotherapy as well. So
Yeah,
it meant that I had surgery in March, chemotherapy started in May, and I had about 6 months of that, and then radiotherapy for 10 sessions following that.
yeah,
Um, and then I'm on a medication called, so it's a aromatase inhibitor, which basically means that it sort of stops any production of estrogen from testosterone within the body. So
yeah.
I'm joyfully in the menopause.
Yeah, just to add to it all.
Yeah, that keeps on giving. Yes.
Yeah,
So it was and saying all that makes it sound like it's a really, really straightforward, simple course. It's really not.
yeah,
At each point, there are obstacles and things that don't go to plan, and you're dealing with the side effects of chemotherapy, the emotional side effects,
yeah,
symptoms, um, the trauma that you really go through. You don't really
yeah,
recognize that you're going through that day by day until afterwards, even
yes.
after you stop the treatment. You look back, that's the time when you actually sort of
Yeah,
look back and see what you've gone through.
yes.
So EFT was so helpful at every single point in that process.
Yeah.
Um,
Can you share where you used it the most, or what were the kind of the real things that you used it for?
yeah, so um, mentioned before the waiting, I used it for that, for the anxiety. Even in the corridor before going into the appointment where your anxiety is peaked, I used it there. I didn't care what I looked like. I used it a lot for the initial, it's the you talk about chemo and you think about losing your hair. And for me that was a massive,
Yeah,
massive thing to come to terms with. It was a very emotional thing for me.
yes.
And still is when I think about it back to it. But I worked on that an awful lot,
Mm.
and I tapped to help me reduce the anxiety about that and to increase my confidence around it, and to accept it. Even though I definitely do not want that to happen, but so I used it for that. And I proudly walked down my local high street with my bald head, many a time, and I do attribute EFT to help me accept that and to sort of embrace it.
Yeah,
I
it's interesting because like that sort of is more a change of mindset rather than actually what physically happened.
Yes, absolutely. It was my protection, my confidence, my identity, my
Hmm.
link to my childhood. There were so many things about it that I had to deal with and work through.
Yeah.
And But even by doing that, actually it helped with a lot of other things from childhood.
Yeah.
As an EFT, you always get so many more benefits.
Mm.
So I am thankful now it's grown back and
Very lovely.
thank you. But I've embraced it as I've gone through it. I definitely was not one for wigs. I just couldn't wear them. I was frustrated by them. So I'm so happy that I thought, no, I can do this. I'm happy. I can hold my head up high. Um, and do you know, it's one of those. But you had to deal a little bit as well with through that with you're so visible, but yet invisible because people look at you and then look away.
Yes. Yes.
So I again had to work through that a little bit. So
Mm.
EFT helped with me doing that.
Brilliant.
So that was a major thing with EFT that really, really helped, and I'm so grateful I had it for that. Also, chemotherapy side effects for me were pretty awful,
Mhm.
especially in the first round. Um, I had a bad reaction to the anti-sickness medication.
Mhm.
And I felt completely out of my body. I felt my body was vibrating. Just felt sort of quite unwell with it for about 2 weeks.
Yeah.
Um, and also then I discovered my liver enzymes had just gone completely very, very high due to the chemotherapy as well. So I had to work with sort of the feelings of sickness, of nausea, and headaches, all of which EFT were fantastic at helping control
Yeah.
and helping reduce the. I still do it to this day when I have a headache. I use the technique that we used together, where I was imagining my head was just being squeezed by hands, and that I had to choose people to help unsqueeze or take the hands off. And I did, and well, not bizarrely, I chose my mum and my dad. Um, which is unusual because in real life they wouldn't really talk to each other. So the fact um, that they were helping me do that and to release that tension in my head was amazing. And I feel it even thinking about it now. I can
Mhm.
feel just tension released from my head. So
Nice.
it has such long lasting effects,
Yeah.
um, and very quick effects,
Yeah.
that I just am amazed by, but fully embrace and love it. The fact that EFT can do that.
Yeah.
Um, so side effects like that, and also I had to have a PICC line, which is a line inserted into your
Right.
arm which you live with for 6 months. It's a right pain. Um, and I got a clot in, in that around it in the first 10 days of having it. So again, that caused me a little bit of some issues. And I also mentioned the liver being sore and causing me problems. So EFT helped me come to terms with those things. So I still remember Percy the Pick Line and Lenny the Liver that I gave names to too. And I was very thankful to them in the end that they were there to do the job. But
Mhm.
again, I had to tap on that to get to that point because I hated both of them at the start. I used it to be able to change my emotions and my feelings towards
Yeah.
those things that I just had to live with
Yeah.
through the chemotherapy.
Yeah.
Um, and it also helped me at night time when I was couldn't sleep.
Mhm.
I had a lot of fear. I had a
Mhm.
lot of dread about what would happen, uncertainty,
Yeah.
and the fact that my mum had died from it and the phrases that were going through my mind. A friend had said to me in the past, when unfortunately, his mum had also died from breast cancer. It's so different now. That was 20 years ago, 25 years ago. It's so different now, but my mind was thinking that. So it took a lot of work for me to get rid of that and not think that.
Yeah.
So I I am thankful, and I don't think that I don't have that in my head anymore. I
Yes.
don't think that
Great.
that's a sort of a it's not a recurring theme.
Very good. Yeah, there's so many areas, aren't there, that you can use EFT in. You know, it's limitless, really, isn't it?
Absolutely. Pain, like pain control is what pain, nausea, vomiting, the headaches, yeah, all those side effects, but also the waiting, the stress levels,
Yeah,
the thinking about the future, the coming to terms with things.
yeah,
And also through radiotherapy, like the radiotherapy is a fairly confronting thing.
yeah,
You're laid bare on the table and it's um, you've got to stay still. So I use tapping through
yeah.
that and
Brilliant.
also through scans, MRI scans and bits and
Yeah.
pieces. I've used it as well.
Did you do the
Um,
one-handed
the
secret
one-handed,
tapping?
very still. They
Yeah.
said they said I was one of the stillest people,
Wow, even though you were actually
even though I was
tapping.
tapping.
Fantastic. And
And
I know other people who've actually envisaged that they're tapping. They've just been lying there in the MRI or in the radiotherapy, imagining tapping on the points, which has also been really effective.
yeah, and I do find that very effective and tell people about that as well.
Yeah,
It's a great thing to do, and it really does. I feel it affects myself where it calms me down if I'm imagining it,
yeah,
and we know that the science shows that it does help as well.
yeah.
So yeah, definitely grateful for all things EFT.
So it helped you navigate. And I think you also have used it for the medication you're on now and side
Yes.
effects of that medication too.
Yeah, absolutely. So the aromatase inhibitors, apart from the menopausal symptoms that you get, which a lot of people think about are just hot flushes, sweats, those types of things. That's all for me. I'm okay with that. I can, if I have it, I can cope with it. Okay.
Yeah.
Um, if I have a lot of joint pains, which come with aromatase inhibitors. Not everybody gets them. People might get them to varying degrees. I'd hope that I wouldn't get them. Um, but I found I was again a fear. I use my hands. I am an acupuncturist by trade, more or less now. I haven't gone back to GP yet. I don't feel physically or mentally able to do that still yet. Um, but I have I was worried about my fingers not working, and I so I have to I work on those. So whenever I do it, use EFT, I can reduce the level of pain, reduce my fear about the future with it, be more accepting of it. Still
Yeah.
frustrated now and again, don't get me wrong.
Sure.
Um, and again, I still work through I've got a bit of again, menopausal type stuff, word finding difficulties at times, difficulties with the word, wondering why I'm in a room, etc. Um, and again, you worry about those things for the future. I love learning. I use my brain an awful lot. I love continuing to learn about all the integrative practices with work. Um, and that was a real fear that I
Yeah.
would lose that as well. So I sort of again use EFT when I get a wee bit anxious about that on a day-to-day basis and sort of help my boost my brain
Yeah.
health a little bit with it as well. Um, and but again, these things I've gone through all of this, but it's helped me to some
Yeah.
degree. I've learned an awful lot more. I've a lot more empathy. Again, whenever I'm dealing with people on a daily basis and what people are going through. And it's benefited me personally.
Yeah.
So not been not been a bad thing.
No, no. And it really is, there's always, some sort of wake up from it, some sort of turning point in life. Yeah.
Yeah,
If you embrace that, if you choose to embrace that, let's say.
absolutely, absolutely. And I have a lot of inner child. I love doing inner child work with tapping. I think it's one
Yes,
of the best things.
me too.
Um, and it just helps me so much. And I have visited many of my
Your
younger
children.
selves. Yeah. And it really has helped me sort out a lot of things from the past and those day-to-day things that we deal with as well. And the confidence and not good enough, all those things that are in the
Yeah.
past. And yeah, just those challenges day to day. But I love EFT for the fact that you can just do it straight away if you're feeling it.
Yeah.
You just go
Just
for it. You
that.
start tapping, and tap through it.
Yeah.
So yeah,
Fantastic.
lots of lovely techniques to use.
There are. And I think you're working now one-to-one with people who are going through cancer, whatever
Yeah,
stage they're at.
I am. So both with acupuncture and some EFT, and also for those things like nutrigenomics, which is how your DNA
Yeah, right.
sort of can your biochemical pathways can be affected or improved with nutrition. But one thing we know about our That's why I did it after my breast cancer diagnosis. And one of the major things that comes with it is that stress, anxiety, also influences how your pathways work.
Yeah, of course.
And again, if you can use EFT to reduce your psychological trauma, you can use it to reduce your anxiety, you can use it to help you get through, not only for cancer, but for any condition, any illness. It's going to improve your health.
Yeah,
Reduces your stress, and reduces your inflammatory markers, helps, yeah, with all those lovely sort of neurochemicals as well. So I think I would love for everybody to be able to have that to as a tool to use every day. I think that would be my biggest desire about EFT and want to spread the word about it. Because it's something easy to do. You don't have to go to a practitioner to use it. I
yeah,
do think you should go to practitioners whenever you need to and go into deeper work,
yes,
because we all would benefit from that. But it's something that I think on a day-to-day basis, absolutely everybody in the world would benefit from.
of course. We
Yeah.
think, yes,
Yeah. So for me, I that's why I want to do. I'm doing those little bits of group work just to try to initially just spread the word a little bit and also help people with that. And then hopefully at some point in the future do some sort of do more group work, do spread more, do talks, sort
yeah,
of try to
fantastic.
influence the medical community a little bit more, although it is embraced and used by a lot of charities, which is good.
Yeah, it is great.
Um,
Yeah,
yeah.
yeah,
So I would definitely you want to spread the word a lot more.
absolutely. And you're quite well positioned to do that because of your medical background. You probably have more influence than I might, for example, because you come from that background.
Maybe I've got a sort of maybe a way, an easier way in, maybe. It does take a bit of convincing to still with some of the medical community, but it is being embraced more. There are so many good like institutes like the National Centre for Integrative Medicine who fully embrace
Yeah,
and want to educate or are definitely educating sort of some more of the medical students. There are a lot of good charities that do that, like Yes to Life and um, but Action Cancer in Northern Ireland provide EFT and things like that as well. So
amazing.
hopefully, yes, I would love I have a little. I hope I can use that, yeah, as a way forward as well to
For
spread
sure.
the word a little bit more. And I'd love to tell more GPs about it. It would help. Um, it would help if we could give all the patients that, then they would be able to manage a little bit more things themselves, maybe.
Yeah,
Um,
yeah. And the GPs probably need it themselves, don't they?
yeah.
For sure.
Fairly stressful job, a very stressful job. Oh my goodness, yeah, they do a good job, and it's very hard at the minute for a lot of them. So, yeah, definitely, it might help reduce their stress a little bit as well.
Yeah. So if you were to give advice to anybody who'd maybe just received a cancer diagnosis or thought they might be about to receive one, that maybe they're waiting for tests like you were, what would you say? What would you recommend, Maria?
I would recommend that they find out about things that can help them, but for finding out about EFT, to look at the websites, to look at the Peta Stapleton website. It has lots of lovely information, lots of research based there. It has a good demo to look at websites or look at your videos as well on YouTube and things like that. Um, I would say that to look up the cancer charities early on and see if they do offer some integrative help,
Yeah.
because the earlier you get in, the waiting list is massive. At the minute I looked this morning, there's just you can't even make an appointment for 6 months' time. There's just no availability.
Mm.
So to get onto their list as quickly as possible,
Yeah.
to talk to their oncologists about what other support is there. Um,
Hmm.
there are lots of charities linked to the ho different hospitals.
Yes.
Some oncologists are very open to it, some aren't.
Yeah.
It depends. You've got to advocate for yourself a lot as well, I would say.
Yeah.
And I would say always take the time to think and not rush in to things as well. Always bring somebody with you maybe to make sure that you get the information,
Absolutely.
but take the time to think and think, well, what else can I do to sort of add into my treatment that's maybe going to help me? And
Yeah.
talk to the charities that are there, like Macmillan Cancer or Action Cancer,
Yeah.
Yes to Life, they can offer you advice. They can do things online. You don't
Yeah,
always have to be somewhere, and people don't want to maybe travel whenever they're having chemo, etc. You're immunocompromised. So a
yeah,
lot of online sessions can be really, really helpful.
yeah, that's great advice. Yeah. And
Yeah, and
also, I think it's quite regional. I've come across some NHS trusts in the UK which are really pro the alternatives, as you say, others, and some oncologists who are like, no, you cannot do a thing.
yeah, absolutely. But
Shame.
I think for EFT, if they know about it, I think they would be very open to it
Yeah.
because
It's
it's
not
not,
invasive. It's not,
yeah.
it's just reducing stress.
Definitely. So it's not that you're taking a medication that they think, like a supplement that they may think may
Yeah.
somehow change the sort of the effect of the chemo, or you're not sticking needles into people where they think that might reduce infection, which it won't. Um, but for me, it's always about whenever it comes to cancer, you're when you got to the point where they're killing the cancer cells. With chemo, I'm happy I've had it. But I wanted to not return to when my new lovely cells were growing. I didn't want them to return to a toxic environment, that soup that
Yeah.
our cells live in. I wanted to make sure that I was doing all I could to make sure that the environment that they were now growing in was one that was going to be help a healthy growth, a
Yeah.
healthy future.
Yeah.
So for me, that was important, and EFT was a massive part of doing that. Um, and again, I am doing it on a daily basis. I'm reducing my stress by using it. I'm um um yeah, using it for all of the symptoms that I or experiences that I currently have due to the treatments that are still ongoing and within my body,
Mhm.
and helping with. So for me, changing that environment is really important for your life you're going to have after the treatment is over.
I think that's such a great point, isn't it? Because I don't think for anybody you can go through cancer and return to the life you had.
No,
Or you maybe can try, but you've changed. Everything's changed. Your world's been rocked, hasn't it?
yeah,
Um, yeah, and I just think embracing that to some degree and taking that forward and yeah, maybe making this a new start. So
yeah.
many people I speak to and my own personal experience as well is that, it's a turning point in life, but it's always for the better.
Yeah, absolutely, absolutely. It is, and I was thinking about that this morning. Actually, the people used to say, "What's your new normal?" And I was like, I hate that. I was
Yes.
like, I don't want a
They
new
used to say
normal.
that after COVID, didn't they? Or during COVID.
Yeah,
Mm.
like I don't want a new normal. I want my normal. Or, but
A
actually,
better normal.
and that's the thing. I want to better that. And this morning I was going, actually. I'm happier that I have a different normal.
Yeah,
And it is a better choice, and I've made better choices since the diagnosis through
yeah,
all mentally, physically, emotionally.
yeah,
Um, Still obviously work on things daily, but
sure.
as we all do in day-to-day stresses and life can take hold, and you can sometimes go back into old patterns, but I'm much more aware of it. So I think that is also important for people who've like me are very lucky in the fact that they've come through their treatment, and I am now I'm maintaining my I don't have secondaries. I'm very lucky. I don't have metastatic disease. But for even for those with metastatic disease, I think something like EFT is so important because it's such a stressful day. I've imagined it. I haven't lived it, but I think that it's something that would help people on a day-to-day basis
For sure.
to cope with it.
Yeah,
So I think it's
absolutely.
really important for to give people that sort of reduction of stress every day to some
Yeah,
degree, be able to
yeah,
manage those side effects through secondary cancer as well, metastatic cancer.
yeah, yeah. I agree, 100%. So, Maria, if people want to get a hold of you, we can share your links. We got your links below,
Thank
so
you.
people can do all that. Any last words? Anything you'd like to add? If any doctors or oncologists are listening.
Well, I'd say to embrace if people are wanting to talk about it, to encourage them to maybe go and seek out that help, to be open to some of the integrative medicines to if they are not as aware of them as maybe they could be, to look at places like the National Centre for Integrative Medicine or Yes to Life, but for looking at EFT and Peter Stapleton's website, looking at the research day by day that is being collated, and yeah, just to at least acknowledge that the person thinks it's important to talk about. And I think that sometimes it's just that acknowledgement that um, the oncologists are very busy, their jobs are very, they are doing the right things by their research,
Mm,
but it is important to allow those other therapies, I think, to help the people because it's something that will help the outcome. It will help the outcome.
yeah, it benefits everybody, doesn't it?
Yeah, absolutely. And reduce the stress on the NHS, hopefully, as well, which again is never a bad thing. But it would be wonderful if AFT was available at every oncology centre as well.
Well, yes,
Um,
let's hope that's a vision for the future.
absolutely, absolutely. But I think EFT, I always treat it as I do feel like it is I always say it's like a gift to me because it has helped me so much.
Yeah,
And from the science point of view, it works. From a physically, emotionally, me doing it, I know that it works.
yeah,
So I would definitely encourage people to look into it. It's an option for them, and it's
yeah.
something that at least it's worth a try.
Yeah, exactly. You've got very little to lose, haven't you?
Absolutely, absolutely.
Maria, it's just been so joyful to speak to you today. I'm so happy that your recovery has been so successful. And yeah, just an amazing, inspiring story that you've shared
Oh.
with us.
Well, thank you very much, and thank you to you too for all your wonderful skills and for teaching so many of us about EFT. It's just been, and also continuing to help us and to educate us and keep us up to date. So no, I really, really appreciate it, Mary Jane. Thank you.
Brilliant. Thanks for being here and speak again soon.
Thank you.